Thank you, Dr. Haskell. Thank you, Dr. Song. I again want to express my gratitude to the President, Dr. Kozarek, and the organizing committee for the opportunity to contribute to this session. Well, this is certainly a unique session, and in fact, when Dr. Song invited me to speak on this topic, I actually had to think back. How did I learn how to make a presentation at a scientific meeting? Certainly, we do not learn this in medical school or even residency. This is really a skill that we learn when we attend our first scientific meeting and we watch others present. So we learn by watching, and then we learn by doing. And we practice and practice and practice. Now, this is how I felt the first time I presented many years ago at my first scientific meeting. My knees trembling, I was sweating up a storm. I felt like the audience was glaring holes into me, and I was under the spotlight. I felt like an insect being dissected under the microscope. And so this is a normal experience, and even today, I'm nervous every time I'm at the podium. A successful presentation starts, of course, with that foundation of knowledge. You are the expert of the field, and you have total command of this field that you are speaking on. Now, there are a number of dynamic variables that interface with that knowledge to make a successful presentation. You have to exude confidence. You are, after all, the expert, and the audience is learning from you. So you must show that confidence, and that is based on that foundation of knowledge that you bring. And you must exude enthusiasm. This is your passion. This is what you love doing, and you want it to be contagious. And this will reinforce you as the expert in the field. And there simply is no substitute for practice. You have to practice in front of your colleagues, but also practice in front of those who may not be experts in your field or knowledgeable in your field, even in front of family and friends, because they may be able to give you some helpful tips. Now, of course, there is a standard template to every scientific presentation, and it starts with that background, and you're explaining why it is you're doing the study, and then you present the aim or the hypothesis of your study very succinctly. Then you turn to the methods, and that's divided in different sections. You're going to talk about the study design. Is it retrospective, prospective, randomized, blinded? You're going to talk about the patient population that is being studied. Is it a single institution or multiple institutions? Then you're going to move on to presenting your results. And in the results, depending on the type of study that you're presenting, you might emphasize the technology and the outcomes of that technology. You might include some videos, as we've seen earlier, to illustrate those results. Your conclusion should be succinct. It's very important to acknowledge your collaborators as well, those who helped you make the presentation, to collect the data and allow you to present. And then you would also thank the audience for their attention. Now, you are presenting on a scientific topic, but style matters. You need to connect with the audience from the moment that you're at the podium. And the best way to connect with your audience is to look at the audience. Look around the room. Pretend you're looking for somebody in the audience. That way you make sure that you're really acknowledging everyone and you're engaging their interest. Use your own words when you present. Yes, you can practice, you can rehearse, but when you stand at the podium, use your own words. Do not memorize. and certainly do not read from a script. Now, this is the third point, is the most important. You must speak loudly and clearly. You can have the best presentation, the most amazing study. It will not be recognized and acknowledged if the audience cannot understand you. Now, as a foreign speaker, if you have an accent, then you will be forgiven for any problems with pronunciation or grammar. The native speakers understand that you have this hurdle to overcome, but you will not be forgiven if the audience cannot understand you. You should use short sentences if possible. This is not the manuscript. This is a communication of take-home points. And finally, use vocal special effects. Your voice will emphasize certain aspects of your presentation. You can add a pause for emphasis. You can even repeat something, what we call the echo effect. Say it twice if it's important and you want your audience to remember that point. Now, these are two acronyms that I think you will find helpful. KISS and KILL. KISS is keep it short and simple. And KILL, keep it large and legible. So let's talk about these two acronyms. KISS the presentation. That means less is more. Stay with simple concepts and think about take-home points for the audience. We tend to overdo these presentations, present too much material. It's too much to be able to extract all the details. Do you want to leave the audience with those major messages? And then kill the slides, because we tend to present too much in our slides, too much detail, too much data. So we're going to exclude some of those redundant slides or unnecessary slides. And what I recommend is the rule of sevens. No more than 7 words per sentence. No more than 7 lines per slide. Do not use full sentences. And certainly avoid tables from publications, because those tables tend to be with small script with far too much data. You may show a graph, but don't show any of the table material in columns and rows. That tends to be too much material. Create a synopsis yourself that is easy to understand. Now, proper etiquette is important. Before the session, you should introduce yourself to the chairman and the co-chairman. This is a way of putting you at ease already. You can tell the chairman a little bit about yourself, and you might even ask what question might be asked. Or you could suggest a question that you could be asked, and this will make you less nervous. You will always start the presentation by thanking the chairman and the co-chairman, and thank the hosting society for the invitation to present. And you will end by acknowledging your collaborators, and you will thank the audience. Timing is everything. Do not run over time. In fact, as I'm speaking right now, I'm looking and checking. I've got another minute. 1 minute per slide is the rule. Pace yourself as you go. Do not digress. You can be spontaneous, but make sure you don't go off on a tangent. And you must rehearse, of course, beforehand. And leave time for some questions and anticipate what those questions might be. And you should have those questions mentally prepared. Some practical tips. Double check your slides beforehand, of course, in the AV room, but you may want to rehearse the whole thing again right before you get on the podium. Familiarize yourself with the room equipment. Go up to the podium, check which are the buttons that advance the slide, go backwards. You don't want to be caught not understanding the tools. And review the mechanics of slide advancement, as I mentioned, and you want to feel comfortable with your stage. So in conclusion, There are 4 ingredients to a successful presentation: knowledge, confidence, enthusiasm, and practice, practice, practice. Style and etiquette are important. Kiss your presentation, but kill your slides. Timing is everything. Thank you very much.
Very